Yeah, and you talk about the situation in other countries also being incredibly pressurised as well, and yet we hear that the UK has the highest excess death rate of any G7 country. Our nurses are paid worse than most other European countries, and here we are, a right-leaning paper this morning saying, come on, Rishi, do a deal for Britain, get this nurses negotiation done. Now, other papers are reporting that you're quite willing to do that, you're quite up for it, but it's Number 10 that's blocking it. What's going on? Are we going to have these backdated payments for nurses or not?
Well, we were discussing with the unions how we make any settlements more affordable, particularly focusing on the coming year's pay review body. But of course, I listened to the representations from the trade unions in terms of the cost of living pressures that they face here and now. But the independent pay review body looks at what is affordable across the piece. What we're keen to explore and have been exploring is where there's opportunities to go further through productivity, through efficiency, looking, for example, at the significant agency costs, looking where technology...
It's offensive to nurses working 18-hour shifts, as you say, inspecting patients or looking after patients in waiting rooms in awful conditions, going home and crying because they cannot give the care that they have been able to give up until now throughout their career. To ask them to make efficiency savings or better productivity when all they're saying is, hang on a minute, I cannot afford to eat properly at the moment. Nurses going to food banks, and you're refusing to even discuss the issue, just want to talk about next year.
No, what we're saying is it's this coming year, the pay that would apply from April, and it's about how we get the whole system working better. One of the things that nurses, indeed, and that's what we're discussing with the trade unions in terms of how we get the interfaces, how we get more technology, how we ensure that people can be avoiding what they say to me is often their frustration, the high cost of agency, the technology that is not enabling them to do their jobs as effectively as they want, many of the irritations in terms of for example, having to phone around to get information in hospitals. I was at Maidstone last week looking at how much better it was for staff, where there's a control centre in place, where they've invested in technology, where they're able to get better flow into the hospital. So there's things we can do better in terms of getting the system to work. That's what the unions themselves said they wanted to see on Monday. There's opportunities for us to get those sort of systems in place. So there's a range of things we can do. Of course, the pay review bodies is the right process to do that. That's something, as I say, even the opposition recognise that we should settle these things through the pay review bodies. But we're listening to the unions, we're engaging further with them today, and we're discussing that across the government.